Global burden of disease aims to make the best estimate that we can of how many people in the world die, how many people suffer from a wide range of diseases that are all important in making decisions about how we spend money on healthcare. So the two link together. So if you know how big health problems are and you have information on all the different ways in which you can spend your health dollars, how much for each dollar investment you get in terms of health outcomes, that together is the most powerful set of information that you can give to policymakers. So then they can make a decision, well, if I shift my budget this way or that way, these are the implications in what happens to the health of the people. I think the interesting thing of the Roux Prize is that it tries to gather that connection between the data and policy, and it tries to put in the highlights the people who have somehow picked up on global burden data and have done something meaningful with it and translated it into policy. Because too many times as researchers we think, well, we've done all the hard work, here it is, now it must be used. No, of course it doesn't happen like that. There's a lot that needs to happen for the right information to slot in to the, into the decision making at the right point in time. I think the easiest example is the tobacco control policy in Australia. And so in order to help direct health policy on how best to, what has in politics become the phrase, close the health gap, we quantified in great detail what contributes to that big gap, not just in life expectancy, but also in quality of life between the Aboriginal and Torres Strait Islander population and the rest of the population. And as part of those estimates, one of the top contributors to that big gap in health status was tobacco smoking. It was by far the largest risk factor, and also the largest risk factor that made the difference in outcomes between the Aboriginal people and the rest of the population. Jane Halton, as the head of the department, was well aware of the study happening, saw the results being published. Headline result was, tobacco is the #1 risk factor by far, and said, okay, well, we're going to do something about it. And she was able to do something about it.